Hello folks, welcome back. If you are new around here, my name is Kweku. I am a pharmacist. Today I'll be reviewing the medication Tramadol. We're going to take a deep dive into its description and uses. We'll take a look at its dosing, some side effects, and some precautions or best practices. Before we delve any further though, just wanted to remind you that this review is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So what is Tramadol? Well, Tramadol is described as a centrally acting analgesic or a centrally acting pain reliever. Now, centrally acting pain relievers like Tramadol bring about relief of pain by acting on certain receptors in the brain. In other words, their place of action or the site of action is the brain. And in this case, it is some receptors called the mu-opioid receptors. While activating the mu-opioid receptors is a means of achieving pain relief, the downside is that those receptors are also responsible for the body's reward system and may potentially produce euphoria, and that is what causes the addictive behaviors of people that take medications that act on those receptors. We'll talk more about that when I talk about the precautions and the warnings. Tramadol is also a synthetic analog of codeine, that is, its molecular structure looks like codeine. The good thing about Tramadol though is that it has relatively less potential for abuse or respiratory depression than some other opioids. The risk still exists though, but it is just minimized relatively with Tramadol. So as mentioned earlier, Tramadol is basically a pain reliever. It is used for different kinds of pain like arthralgia, which is simply joint pain, diabetic neuropathy, postherpetic neuralgia. This is a condition that affects the nerves. It's typically a complication of shingles and chickenpox, osteoarthritis, and a whole lot of other kinds of moderate to severe pain. With respect to dosing, Tramadol is available both as an immediate release or an extended release tablet. The immediate release tablets is typically dosed 50 to 100 milligrams every 4 to 6 hours, capping usually at a max of 400 milligrams per day, while the extended release tablet is typically taken as a single dose daily, anywhere between 100 to 300 milligrams per day. Now, when it comes to side effects, drowsiness is usually one of the most commonly reported side effects. As a result, you need to be careful when you first start taking it, know how your body reacts to it before you drive or operate any machinery, as we normally say. Dizziness and vertigo have also been reported, and also nausea and vomiting. Now, nausea and vomiting was reported more frequently in people taking the immediate release tablets. A slow dose titration, increasing immediate release tablets by 50 milligrams every 3 days or so has been associated with a decreased incidence of nausea and vomiting. Anorexia has also been reported, as well as constipation. Now with constipation, it looks like the longer you take it, the more prone you are to constipation, because in one study, they realized that 24% of the people receiving the immediate release Tramadol experienced constipation at 7 days of treatment. That number or that percentage increased to 46% for the people in that study that took the Tramadol for 90 days. So that gives an indication that the longer you stay on Tramadol, the greater the risks of developing constipation. Pruritus, which is itching, diaphoresis or increased sweating, as well as euphoria, which we talked about earlier, xerostomia or dry mouth, as well as restlessness and seizures have all been reported. So with respect to seizures, I'll talk about that in the precautions, but if you have a history of seizures, you just want to double check with your doctor to see if Tramadol is actually appropriate for you. And then of course, this list is not exhaustive. There may be some other side effects that you may experience while on Tramadol, so do well to let your doctor know of any unusual things that you notice while you take it. Now on to some warnings or some best practices. And the first on the list is addiction and potential for abuse or misuse. Now, while this risk is relatively lower than compared to some other opioids like, say, oxycodone, the risk definitely still exists and therefore should definitely be taken into account. For that reason, people with a personal or family history of substance abuse or even mental illness should be monitored closely if they are to take Tramadol. The next warning or precaution is respiratory depression. Now, this is a situation where the breathing is slow and ineffective. There's a buildup of carbon dioxide in the system as your body is not able to completely get rid of it. And this risk is increased if Tramadol is combined with other medications that produce the same effect, like some of the benzodiazepines like Xanax, diazepam, or even some other pain medications like oxycodone, or more commonly, alcohol. I would definitely not recommend anybody taking their Tramadol with alcohol. Some signs to look out for in respiratory depression include tiredness, shortness of breath, slow and shallow breathing, as well as confusion. If you notice any of these while you take tramadol, definitely seek medical attention. Now, the next precaution is for people with a history of seizures. People with a history of seizures should generally be cautious if they take tramadol. This is because tramadol lowers the seizure threshold, especially at doses that exceed the recommended range. The risk is even higher if the tramadol is taken concurrently with other medications that also lower the seizure threshold. A typical example that I can think of is Wellbutrin or bupropion. So be sure to let your doctor or pharmacist know of all the other medications that you take so they can perform a drug interaction check and make sure that you are in the clear to take tramadol. Tramadol has also been associated with withdrawal symptoms if it is discontinued abruptly. It is generally not recommended to discontinue tramadol abruptly, as you may develop some adverse reactions. Some of these adverse reactions have included uncontrolled pain. Your body gets used to the drug. This does not necessarily mean that you are addicted to the medication. Addiction is typically a behavior related to getting and using a medication for a non-medical reason. If you have pain, you obviously have a medical reason to take the pain medication. Therefore, if you have to discontinue tramadol for any reason, your doctor will typically slowly taper it down over a couple of days, weeks, depending on the particular scenario, just to avoid any of these withdrawal symptoms. Another group of people that should be cautious when it comes to the use of tramadol is pregnant or breastfeeding moms. Tramadol is known to cross the placenta, and based on animal data, tramadol has been shown to cause fetal harm. Breastfeeding is also not recommended during treatment with tramadol because of the potential for serious adverse effects, including excess sedation and respiratory depression in the breastfed infants. So if you fall into this category, take note. Caution should also be exercised when the elderly take tramadol. This is because the bioavailability of tramadol increases with age. Now, bioavailability is simply the proportion of the medication that enters circulation and therefore can cause some effect. Since tramadol's bioavailability tends to be higher in the elderly, the risk of developing some of the side effects we've discussed tends to be higher in the elderly. This may make them more susceptible to falls and fractures, and therefore caution should be exercised when tramadol is prescribed for the elderly. Like I mentioned earlier though, if you have pain, then there is a legitimate medical reason for you to take tramadol. Just stay within the dosing guidelines provided by your doctor and report any unusual side effects, and for the most part, you should be fine. So that's a high-level overview of tramadol. I hope you found some value in it. If you did, consider subscribing to the channel for more videos like this, and I would also be grateful if you would give me a thumbs up on this video. Thank you so much. I will catch you on the next video.